Hello friends, I'm back with my next video on pharmacology. Let's learn pharmacology. So today we'll be discussing on the routes of administration of the drugs. What is route of administration of drug? It is simply any path by which a substance or the drug or any fluid is brought into contact with the body. It is the route of administration of drugs. So we have different routes of administration of a drug. Drug can be administered by various routes. Selection of the route of administration of drugs, it depends on drugs and the patient related factors. Here we'll be discussing the some factors while considering the drug routes of administration of the drugs. First is characteristics of the drug. Next is emergency or the routine use. Next is condition of the patient, age of the patient, associated diseases. Sometimes it is patient's or doctor's choice. Here we'll be discussing the classification on routes of drug administration. Here we'll be only discussing its classification. Later on we'll discuss in detail about each route of administration. Okay, so here we'll be remembering only its classification. Let's start. We have local route, systemic route, right? In local route we have topical route. We have ear drops, eye drops, nasal drops, skin ointments, lotions, powders, creams. Whereas in systemic part we have enteral route, parenteral route. Okay, two routes. In systemic we have enteral route, parenteral route, E and P. Okay, enteral route means through the mouth, whereas parenteral means other than the mouth. Enteral means through the mouth, whereas parenteral means it is other than the mouth. Next we have, in enteral we have oral, sublingual, rectal, whereas parenteral we have transdermal, inhalations, injections. Remember it as OSR, oral, sublingual, rectal. And parenteral we have transdermal, inhalations, injections, IIT. Right? In injections we have 5 different routes of administration: intradermal, intravenous, subcutaneous, intrathecal, intramuscular. I repeat once: intradermal, intravenous, subcutaneous, intrathecal, and intramuscular. So hope you people understood the classification of route of drug administration. Now here we will be discussing in detail about each route of administration. So first we will discuss about the local route. In this we have topical, right? In topical we'll be discussing what is topical route of administration means. Here the drug is applied to the skin or the mucous membrane at various sites for the localized action. Simply the drug is applied to the skin at various sites for the localized action. We have ear drops, eye drops, nasal drops in the form of ointments, sprays. We have example for this is gentamicin, we used as an ear drops, eye drops. Inhalations, example for this is salbutamol for bronchial asthma. We have different skin ointments, creams, powders. Example is clotrimazole as an antifungal drug. Vaginal tablets, creams, pessaries we use in vaginal candidiasis. This is all about topical route. Next, coming to the systemic part. Systemic route of drug administration. First that we have enteral. In enteral we have oral route. First comes is oral route. Oral route means the drug which is given via the digestive tract. Is the oral route. most common and the acceptable route. This is the most common and acceptable route of administration. We have dosage forms. Oral dosage forms are tablets, capsules, syrups. Example for this is paracetamol, we have as a tablet, omeprazole capsules as antacids. Advantages or oral route of administration is it is safer, cheaper, painless, self administered, convenient for repeated and prolonged use. Disadvantages for this is we can't give the oral route of drugs to the unconscious or uncooperative patients, patients with severe vomitings and diarrhea, and it is not suitable for emergency cases. So it is not suitable for emergency cases because the rate of drug absorption is very slow. Next is sublingual. We discussed about oral route under enteral. Next comes is sublingual. Sublingual, we have what is sublingual route. In this, the preparation is kept under the tongue. The drug is absorbed through the buccal mucous membrane and it enters the systemic circulation directly. Example for this is nitroglycerin for acute anginal attacks. Advantages is for sublingual route is quick onset of action. Action can be terminated by spitting out the tablet. Bypasses the first pass metabolism. What is first pass metabolism means? First pass metabolism is it is used for hepatic metabolism of pharmacological agents, because when the drug is absorbed from the gut and it is delivered to the liver via the portal circulation, then it is entered into the systemic circulation. Simply when the drug is absorbed orally, it is transported to the systemic circulation via the liver. So sublingual route bypasses the first pass metabolism. Hope you are understanding the term first pass metabolism. What I am trying to tell you. Drug absorbed orally, it is transported into the systemic circulation via the liver through the portal vein. Then it enters into the systemic circulation. Right? Disadvantage for this is not suitable for irritants and lipid insoluble drugs, and the drug with the bad taste. Hope you people all understood what the sublingual route means. Next, coming to the rectal route. In this we have suppositories. It is used for local and systemic effects. Example, indomethacin in rheumatoid arthritis. Indomethacin for rheumatoid arthritis. Next, we are done with the enteral route. Now coming to the parenteral route. In this, first IIT, that is injections, inhalations, transdermal. So first we'll be discussing about the transdermal route. In transdermal route, the drug is administered in a form of a patch. It is administered in a form of a patch that delivers the drug into the systemic circulation. Example for this is scopolamine patch for salvia and motion sickness, estrogen patch for hormone replacement therapy, clonidine patch for hypertension, nicotine patch for tobacco de-addiction. Advantages is for transdermal route, we have advantages we'll be discussing, starting with the self-administration and patient compliance is better. Can be self-administered and the patient compliance is better. Systemic side effects are reduced. Again, it also bypasses the first pass metabolism. Disadvantages: expensive. Patch may fall off unnoticed. Inhalations. Next, coming to the inhalations. We discussed about transdermal. Next is inhalations. Volatile liquids and the gases are given by the inhalation. They are given by the inhalation for systemic effects. Example is general anesthetics. Advantages are for inhalations, quick onset of action, and the dose required is very less. Disadvantages: local irritations, increased respiratory secretions, and bronchospasms. Bronchospasm means it is a sudden constriction of the muscles in the walls of bronchioles. There will be a constriction of the in the walls of bronchioles, that is called as bronchospasm. Next is injections. In injections, we have 5 different routes: intradermal route, subcutaneous route, intramuscular routes, intravenous route, and intrathecal route. So, first coming to the intradermal route, here explaining you by differentiating each route. So as to remember it easily. So, starting with the intradermal route. In the intradermal route, drug is injected into the layers of the skin. Here the drug is injected into the layers of the skin. Example for this is BCG vaccine, which is given at the time of birth. Subcutaneous route. Here the drug is injected into the subcutaneous tissue of thigh, abdomen, arm. Whereas in intramuscular route, drug is injected into the large muscles of deltoid, gluteus maximus. These are the name of the muscles: deltoid, gluteus maximus. Right? Next is the intravenous route. Here the drug is administered directly into the blood via vein. Through a vein, drug is administered simply. Intrathecal route. Here the drug is injected into the subarachnoid or into the spinal cord. Okay? Here I am repeating. Intradermal into the layers of the skin, subcutaneous into the subcutaneous tissues of thighs, abdomens, and arms. In intramuscular, into the large muscles. Intravenous into the vein. Intrathecal into spinal cord. Okay? Example for this: for intradermal, BCG. For subcutaneous, adrenaline, insulin. Intramuscular, paracetamol, diclofenac. Intravenous into the vein. Example is ranitidine in bleeding peptic ulcer. Intrathecal, lignocaine in spinal cord. It is injected. Coming to the advantages and disadvantages of each route of administration. Starting with the intradermal, advantages is small amount of the drug is administered. Disadvantages: painful. In subcutaneous, advantages: self-administration, example insulin. Whereas disadvantages: only non-irritant drugs and the drug absorption is slow. In intramuscular absorption, advantage first: absorption is more rapid compared to the oral route. Through intramuscular route, absorption is more rapid than compared to oral route. Disadvantages: aseptic condition is required, painful, self-administration is not possible. Intravenous, advantages is bioavailability is 100% because it enters directly into the systemic circulation and bypasses the first pass metabolism. So it is advantages: bioavailability is 100% for intravenous route, quick onset of action, large volume of fluid can be administered. Disadvantages: strict aseptic condition is required for IV route, self-administration is not possible. Precaution required for IV route: the drug should be injected slowly. Through IV route, the drug should be injected very slowly. And before injecting the drug, make sure that the tip of the needle should be in vein, then the drug should be administered. Hope you all get cleared with the different route of administration of drugs via the injections, right? Here I am explaining you through the diagram of the skin. which is differentiating its layers. So first layer, the top layer is the epidermis of the skin. Epidermis, then comes the dermis. Then we have subcutaneous tissue. Below subcutaneous tissue, we have muscles with veins. So, the drug administered via the intramuscular route, you can see it very clearly that the drug is injected into the muscles, right? Whereas for subcutaneous, the drug is injected into the subcutaneous tissue. Example, insulin. Insulin is administered into the subcutaneous tissue of the skin. By this diagram, you can clearly understand where the drug is getting injected. Intravenous route. Here, the drug is directly injected into the vein. Example we have for intravenous is ranitidine. In bleeding peptic ulcers, we'll give the intravenous route. Intramuscular also is very clear. Example for intramuscular route is diclofenac. Paracetamol we'll give through intramuscular route. Special drug delivery system. What is special drug delivery system? This system has been developed to prolong the duration of action. It has been developed to prolong the duration of action for targeted delivery of drugs to improve the patient's compliance. Like we have ocucerts, progestacerts, liposomes. In ocucert, the drug is kept beneath the lower eyelid in glaucoma, and it releases the drug slowly for a week after a single application. Only a single application shows its results for a week because the drug releases very slowly and shows its effect. Okay, whereas in progestacert, it is a intrauterine contraceptive device that it releases the progesterone slowly for a period of 1 year. Liposomes, they are the small minute vesicles made of phospholipids. Vesicles made of phospholipids into which the drug is incorporated. Means the drug is incorporated in the minute vesicles which is made up of phospholipids. They help in targeted delivery of drugs. Example, liposomal formulation of amphotericin B in fungal infections. Okay, liposomal formulation of amphotericin B fungal infections. Example for ocucert is pilocarpine. So, with this we are done with the routes of administration, different routes of administration. No single method or route of drug administration is ideal for all drugs in all circumstances. Okay, no single method or route of drug administration is ideal for all drugs in all circumstances. Thank you for watching my video. Please don't forget to like, subscribe and share my video. Thank you.